Hey there, my fellow nurses and nursing students. Today we are delving into the life and remarkable contributions of one of the most influential figures in modern nursing. It is, of course, Dorothea Orem. Dorthea Orem, born July 15th, 1914 in Baltimore, Maryland, was not just a nurse, she was a visionary. Her impact on modern nursing is nothing short of extraordinary. Let's begin with a glimpse into her early life and what led her down the path of nursing and healthcare. As a nurse, Orem spent her career dedicated to patient care, but her true legacy lies in the groundbreaking nursing theory, the self-care deficit nursing theory. And you might have heard of it because it is a standard, part of the curriculum on most nursing schools. Orem's theory revolves around the concept of self-care. She believes that every individual has the ability and responsibility to engage in self-care to maintain and promote their well-being. Now let's break down the key component of Orem's theory. First of all, we have self-care. This is the foundation of Orem's theory. It refers to the practice of activities that individual initiates and performs on their own behalf to maintain life, health, and well-being. Second part of her theory is self-care deficit. Orem recognizes that sometimes individuals cannot perform self-care independently due to limitations such as illness, injury, or developmental stages. Third part of her theory is the nursing system. Orem proposed that nursing plays a crucial role in filling the gap where individuals cannot meet their self-care needs independently. Nurses step in to provide support, education, and assistance. And that leads us to the fourth part, theory of nursing systems. Orem also developed a theory of nursing systems which outlines how nurses can provide care to individuals either wholly compensatory, that's a difficult word to say, or partially compensatory. So the two compensatory stages, the fully compensatory, which is where the nurse does everything, full care, where we are the hands of the patient. Partially compensatory, we assist in what the patient lacks. And I would love to dive more in depth with that, but that would be an entirely separate episode. So make sure you are subscribed and have clicked that bell notification icon so you get notified when that video comes online. So how do we apply Orem's self-care deficit nursing theory to modern nursing practices? Firstly, in today's complex healthcare environment, Orem's theory reminds us that the patient-centered care is paramount. Nurses should work collaboratively with patients to identify their self-care needs and empower them to take an active role in their health. Secondly, Orem's theory underscores the importance of individualized care. Every patient is unique and their self-care abilities and deficits may differ. Nurses must tailor their care plans accordingly. And thirdly, in an era of healthcare reforms and emphasis on patient outcomes, Orem's theory encourages a holistic approach to care. It's not just about treating symptoms, it's about promoting overall well-being and independence. If we are to conclude anything about Orem's theory, make sure that you stay along to the end because I'm not entirely finished, but Dorthea Orem's self-care deficit nursing theory continues to shape the way nurses approach patient care. It reminds us that nursing is not just about administering medicine and treatment, but also about empowering individuals to care for themselves. And if you want to know how to get smarter on how the patient can care for themselves and how you should care for them, check out this video over here about Kari Martinson's theory, something that is not widely taught in American nursing schools as far as I am informed, but it is very widely taught in Scandinavia, and it's an entire way of looking at the holistic approach on patients.